How phlebotomy is performed. Routine venipuncture procedure. First, you register the patient. You verify full name, date of birth, sex, full address, government photo ID card. Receive test requests. You're going to verify completeness of test requests and match with labels. Resolve discrepancies before blood collection. Contact responsible party for clarification. Greet and approach patient. Introduce yourself and explain why you are there. Assess patient-specific health conditions. Verify availability of venipuncture supplies and equipment. Sharps container, gloves, tourniquet, tubes, gauze, needle adapter, and other. Identify patient. Use extra care when there is potential for confusion among patients. Question patient and verify according to their ID and ability to respond. Assign a temporary ID for emergencies if needed. Assess pre-collection requirement. Obtain informed consent from patient or guardian. Assess physiological factors that can affect test result. Example, cortisol, tolerance tests, and therapy monitoring. Clean hands. Perform appropriate hand hygiene immediately before patient contact. Assess patient. Identify and address potential complications. Avoid latex when there is patient hypersensitivity. Ensure there is nothing in patient's mouth unless medical required. Position and prepare the patient so patient is seated or recumbent with their arm extended for both safety and comfort. Specimen collection. Gather supplies. Devices must not be pre-assembled. Select site. Apply tourniquet 3 to 4 inches above the puncture site for no longer than 1 minute. A tourniquet left on too long may cause hemoconcentration, which is too many blood elements in plasma. Hemolysis, which is destruction of red blood cells, and petechia, which is red spots on the skin. Patient may clench and hold their fists if their veins are difficult to identify, but must not pump hand. The best veins are in the antecubital fossa, which is inside of elbow. Avoid the brachial artery and nerves. First choice is the medial aspect, which is the center, median and lateral cubital vein. Second choice is the lateral aspect, which is the outer cephalic vein and accessory cephalic vein. The third choice is the medial aspect, which is inner basilic vein and medial aspect of median cubital vein. So the first choice is median vein. The second is cephalic, which is the one towards the thumb. And the third is the basilic, which is the one towards your little finger. Veins on the back of the hand are acceptable. Palpate the vein. Veins are best located by feel. Be sure to palpate with the tourniquet on. Veins will feel spongy, bouncy, and firm. Written, written physician permission is required for non-preferred areas and areas on the same side as a mastectomy. Apply a single-use or patient-dedicated tourniquet for no longer than 1 minute to access vein. If venipuncture is unsuccessful, remove the tourniquet and do not reapply for at least 2 minutes after tourniquet removal. Select and assemble appropriate needles and tubes. If blood is to be drawn from the hand or wrist, the phlebotomist may want to consider using a winged infusion set, aka butterfly needle, with a smaller needle. Avoid using a traditional needle and syringe when possible. Don gloves and keep them intact. Cleanse venipuncture site. Use a clean gauze pad with 70% isopropyl alcohol and back and forth friction unless assessing blood alcohol level or there is a facility specified disinfectant for collection of a blood culture. Allow skin to dry before puncturing it. Re-cleanse if the venipuncture site is repalpitated. Insert needle and aspirate blood. First, examine the needle. Do not use if there are defects. Pre-evacuated tubes if required. Position arm downward when possible. Anchor vein from below and brace the arm. Inform patient of needle insertion. Hold the needle with your dominant hand. Angle the needle 15 to 30 degrees. Insert the needle bevel up and advance needle for free blood flow. Hold the needle steady in line with the vein and stabilize the device. Remove the needle if there is excessive pain or withdrawal of consent. Allow patient to open hand unless contradicted. Do not allow hand pumping. The tourniquet stays on no longer than 1 minute. Remove the tourniquet when blood flow has been established, usually when the first tube is being filled. Fill and mix collection tubes. Fill all tubes to full volume, no vacuum. Remove tube and mix recommended number of times with gentle inversion. Remove tubes, now read that already, and additional tubes in order of draw as prescribed. Remove last tube and tourniquet if still present before needle withdrawal.